So when can you practice self-care? So the great thing about self-care is that it can be practiced daily. It is not something that is only going to be designated for one day a month or anything like that. Even something as simple as stretching, taking a shower, meditating, or even just keeping a self-diary of your thoughts, going for a walk with your dog, anything is really something that you're taking the time to do for you. Not anybody else, not work, not your family, not your friends, for you. And that is really the biggest thing. And it really doesn't matter what it is. It's what makes you happy at that moment that can really help enrich and better your life. And even if you just decide that maybe daily is not something that you need, even if you decide to do it before or after any known stressor or after a stressful unknown event, that could be really helpful for you as well. But that really depends on the self-care technique that you choose. So if you decided to do a full 60-minute Reiki treatment, that would have to be designated on a particular day with the Reiki master, and it would probably be something that you would employ before or after a known stressor or after a stressful unknown event. But if you wanted to do aromatherapy or self-Reiki, if you were a practitioner, or even meditation or mindfulness, you could do that daily. That is something that you can say, I'm going to allot myself 10 minutes today to do this. And that is really when you're going to see the greatest benefit. And that is really what is the key to reducing stress and burnout. So the biggest question is, how do we know if we're burned out? And that question is a really valid one because a lot of the times we can't recognize that we're burnt out. Sometimes being burnt out is so routine you don't even realize you're burnt out. So I decided to throw in this inventory scale called the Maslow's Burnout Inventory. So then you can be able to assess yourself of whether or not you are facing burnout. So the Maslow's Burnout Inventory comprises of three main components, such as emotional exhaustion, where you would be at a high score on that part of the exam, the depersonalization, which is also reflected in a high score, or personal accomplishment in the lower score region. So really the purpose of it is to measure burnout in individuals who work with people, such as in human service profession. So this inventory was essentially designed for nurses. So it is actually a 22-item survey that covers both the exhaustion, depersonalization, and low sense of personal accomplishment. And that there are also multiple questions for each of these subskills, and the responses are in the form of a frequency rating scale. So that is from either like a never, or a few times a year, or once a month, or once a week, or every day. The great thing about it is that its Cronbach alpha is 0.90, 0.76 for depersonalization, and 0.76 for personal accomplishment. So in other words, that's saying that this is really a reliable test to be able to say, okay, this is actually reflecting the fact that I'm burned out and that I may be experiencing a lack of personal accomplishment and that I am emotionally exhausted. So this is a really great tool to use in the any helping profession, nursing or not. So it is a really great thing that you can use. The only issue with this scale is that it does cost $15 for an individual report, and that the instrument is something that you would need to purchase and have permission to use through mindgarden.com. So if you were to actually try to use this either in research or just on yourself, it will cost money, but it is a really reliable way to assess burnout. So this next scale is called the quality of life scale, and this scale is really great if you want to be able to assess if you have compassion fatigue, work satisfaction, burnout, or even secondary traumatic stress. Because you really want to be able to know whether or not you are truly exhausted in being able to care for patients, or even assess how much you enjoy or even feel effective in your helping role. Or even if you are just assessing whether or not you feel hopeless, ineffective, or even unsupportive at work. Or even if it was to be a secondary traumatic stress, such as being exposed to other people's traumatic events. So this quality of life scale is a 15-item satisfaction scale that actually has a grade Cronbach alpha between 0.82 and 0.92 from what I could gather in the literature. And it really is a effective way to assess how satisfied you are at work or whatever you're doing in life. And it's really important as nurses to be able to identify whether or not you are experiencing any kind of compassion fatigue or burnout. I just wanted to provide 2 articles for you to review that I found to be really helpful and interesting. The first one is on the study of complementary and alternative medicine and exploring nursing students' self-use, attitude, and interest to study them. And the second one is on whether or not we can predict burnout among nursing students, and it uses a model of psychological resilience. So in sum, nurses and nursing students should utilize these self-care strategies to really try to help prevent burnout and stress, because they are major contributors to nursing student dropout and even just leaving the whole nursing profession altogether. And all of that is not really indicative of what nursing is, what we pride ourselves in of being a caring profession when we don't even care for ourselves. So this is a really important concept, and I really hope that you were able to take some of these complementary and alternative therapies and use them in your own life, because they are an effective way to reduce stress and burnout. And at the end of the day, we want to promote that psychological resiliency in all nurses and nursing students, so then we can have a stronger helping profession. Because like I said, you cannot fuel and help another person if you don't take care of yourself. So taking care of the self is probably the most important thing that nurses can do. And I really want to make sure that everybody understands and knows that there are ways to be able to deal with this stress, and that there are solutions to it, and that you don't have to live in burnout. This is just a 10-minute meditation off of a YouTube video that I just wanted to close this whole presentation with, because it is a truly relaxing, really nice meditation. And the other great thing about meditations are not only that they center the mind, but they also really can help promote awareness and really just clear your head from all of the busyness that is going on around you. And even if you did not have this 10 minutes to be able to use this YouTube video and be on this computer and be here right now, there are even meditation apps for your cell phone that you can be able to download. One of them in particular that I personally like is the Headspace app. So the Headspace app, it has some free meditations, but it also has a lot of 5 to 10 minute ones that you can do every single day, and they're really helpful and centering, and they at least work for me very well. So I just wanted to at least share that with you, as it's something that I personally enjoy. But I hope you all enjoy this 10-minute presentation, because this one really in particular helps me. So I just wanted you all to be able to have an experience that you can do at home. Lastly, I hope that you all are really able to commit today, that you're going to commit to being more about you, being self-compassionate, and employing a lot of these self-care strategies into your daily life. And I really want you to write it down and just say, this is what I'm going to do today. For instance, during Nurses Week, you're going to say, okay, this is Nurses Week. I'm going to take care of me so then I can reduce burnout. Or if you're a nursing student, if this is the finals time, now that it's summer, I'm going to spend some more time with my friends. I'm going to get that massage. I'm going to go to yoga. I'm going to exercise more. I'm going to fuel my body with the right foods. I'm going to sleep well, or whatever it is that you're going to say that you're going to do for you. And once you're able to do that, that is when you're truly going to have that psychological resilience, decrease stress, decrease burnout, decrease the risk of compassion fatigue, so then you can be that helping, caring profession that you know that you can be.